Now it's time for tonight's Orthopaedic Question Time. Please welcome your host, Mr. Jonathan Dimbleby.
Marion.
Good evening. Do you feel the decrease in post-operative NHS orthopaedic physiotherapy has influenced outcome post-joint replacement?
On the assumption that there is a decrease, Claire?
That's a very perfect question this time. I went to the literature to answer this question. I mean, subjectively, you always want a physiotherapist to see your joint replacement after surgery and possibly before surgery, the ideal situation, make sure everything's set up for them, etc., etc. But objectively, if you go through the literature, there are two studies that we can quote, and there's one in 2008 from Ackerman and Dennett, and another that looked at knee replacements. There's another study from Lowe in 2008, and I think Lowe was a physiotherapist, looked at hip replacements, and they said there was no difference. Physiotherapy was not needed. Now that's the science. I feel that there are a group of patients, however, that we as clinicians, and you as GPs, or physiotherapists if you're involved in the care of triaging patients, you should be picking up the group of patients who you think are going to need a little bit more input. And I think we're duty bound to do that and give them that input. In an ideal world, we'd have a physiotherapist with us, but that doesn't happen. But we all have certain skills, and we can assess a patient's home circumstances, and you have a feel for patients, don't you? If you've been at it for a few years, you know those patients are just not going to do very well, and you can then put in a bit of extra resources.
Certainly from my experience of patients with rheumatoid arthritis undergoing hip replacement, knee replacements, and from your own experience as well, they do come back to us at the main for some more extensive rehabilitation.
Post-operatively, there'll be those patients who said will just fly, and there'll be those who don't. I mean, a classic example is somebody comes to see you for a 6-week follow-up, and they're so worried about things that they come in and they're stiff as a board. They haven't moved in 6 weeks, and then those are the kind of patients that you need to say, just let's really push you forward and really get moving. And some patients need a lot more. So I think the answer is yes. We need to improve the physiotherapy services pre and post-operatively, where I think it needs to be maybe on a selective basis, choosing out those patients that need it rather than maybe a blanket basis.
Because it's just getting more and more difficult to access the service, and it's not the physiotherapist's fault. It's just that there are more and more people demanding the same service with less funding going into it.
All patients need physiotherapy rehabilitation. And the better quality physiotherapy they get, the better the outcome is. I did the same approach and the same hips, nothing new. And since the girls started to do extra classes for patients in Combe Grove manner, within 6 weeks, they are twice as much better. Twice as much better. And I cannot speak of it highly enough. Without these people working close with my patient, certainly my outcomes, or my problems, if you like now the word is, would be low.
Would it be a priority for you to ensure that the resources for physiotherapy were not being reduced, but were being sustained even if the knock-on effect was somewhere else?
Absolutely. If I have to choose the patient come and see me at 6 weeks or see a physiotherapist, they better off see the physiotherapist rather than me, because I wouldn't do that much good to them as she would.